Hi, Derek Neal, iPal Physical Therapy and Wellness. Today I wanted to share with you a couple of exercises that might help you manage low back pain if you suffer from lumbar stenosis. Some people call it arthritis, and on occasion you may even hear it referred to as degenerative joint disease. That's a scary term, but in reality what's happening is when people age, their lumbar spine does begin to go through a degenerative process. And actually what happens is the disc height in the lumbar spine begins to decrease. And as a result, sometimes there's pressure placed on the nerves that branch off the spinal cord in the lumbar spine. And that can result in back pain, maybe even glute pain, particularly with prolonged standing. So if you're somebody that has back pain when you're shopping in United, or you're standing in Barnes & Noble perusing a book or something, I guess what comes to mind is hairdressers and people that have professions that involve a lot of standing. If you suffer from back pain as a result of standing an awful lot and get relief when you sit down or get off of your feet, then most likely you have lumbar stenosis. And I'd like to show you a couple of exercises that can help manage that pain or mitigate that pain a little bit. So simple exercises you can do. What we're trying to do with these postural exercises or dynamic movement exercises is just create some space between your vertebra and your lumbar spine so that it decompresses or takes pressure off those nerve roots. So I'm going to have Meredith here do just a simple exercise. We're going to do lumbar rotation. She's just going to put her feet together. She's kind of in the sit-up position, and she's just going to gently rotate her knees back and forth, just within a pain-free range. So if you're somebody that has some discomfort and you want to get off your feet a little bit and just kind of go through these motions, it can really kind of help loosen up your lumbar spine and create some distance between the vertebrae there and get pressure off those nerve roots. So that's a great way to start, just by doing some simple lumbar rotation. Now, another way that we can increase the distance between your vertebrae and take pressure off those nerve roots is just to simply do a gentle single knee to chest. So just one leg at a time. Pull your knee up. You don't have to provide a lot of overpressure, but just pull gently. And then try this other leg. All right. And then finally, the third exercise I'll show you is just simply what we call a pelvic tilt. And what you do with this exercise is just envision you're going to take the small of your back and you're going to press it down against the mat or your bed. And in doing so, you'll rotate your pelvis backward, just like that. And you can feel the relief there, particularly if your muscles are kind of working overtime to stabilize that lumbar spine. Hold it a couple seconds and then relax. And then do it again. Press the small of your back down against whatever surface you're lying on and rotate your pelvis backward, and then release. Those are just three simple ways that you can diminish the discomfort associated with lumbar stenosis. And so I would encourage you to try those as you have opportunity, and if you would like